Saturday. I got a phone call last night asking me to come in to the assisted living facility that my friend works at. I was there visiting her a couple weeks ago and I was offered a job. The owner wanted me to do med tech for now until I graduate, and then I potentially will have an RN position open. This is another avenue I am looking into other than NICU, is so that it'll keep me in the elderly care population, which I really enjoy and have a ton of experience in. But I'm not looking at doing just patient care for the elderly. I'm looking at the administrative side. And eventually you have to have 1,000 hours or more to where you take a test, a state test, and then you can be like director of nursing and that kind of stuff. So that's kind of, if I ever did that route, that would be my end goal, So this is just like baby steps, get my feet wet into this to see if I even like it, because I've never worked in a facility, always private care, and I really like private care because then I know my patients are treated how I want them to be. So my initial plan was to go in much later today and get in the system, do training, and then I have a night shift, so I didn't want a gap because I have an overnight shift in that area starting at 9 p.m. But I got a phone call last night asking if I could come in at 7 because they were in a really tight spot. So I said sure. I come in and I think it's going to be jump in and learn as you go, which is how I learn best. I really just need training on their computer system because I've never used whatever system they use. Other than that, I really should be okay. And then I have an overnight shift, and luckily I am able to sleep. You sleep in the living room, and the patient has a hospital bed in the living room, and you have care right when you first get there. And then I set my alarm for 2 a.m. get up, check on him again, make sure he's clean and dry, and then up again at 5:30 for vitals and meds. I don't ever sleep really good because I am always listening for him, but I am able to sleep, so I will definitely catch up on sleep tomorrow. And I'll probably be working a couple days at the assisted living facility this week. We'll see. I will let you guys know how it goes.